If you're over 60 and your ankles puff up by the end of the day, don't chalk it up to your shoes. That swelling can be one of the earliest signals your heart sends out, months before anything else feels wrong. Today, 6 signs that turn it into a real heart warning. By sign number 1, you'll know about a 15-second test you can run on your own ankle tonight. But first, tell me in the comments, does your shoe size change between morning and evening? I read every comment, and it shapes what we cover next. A little swelling after a long day standing at the sink or sitting on a plane is common, and most of the time it clears up on its own. The heart pumps blood out to the body and relies on the veins to carry it back up against gravity. When that pump loses even a fraction of its strength, blood backs up in the leg veins, pressure builds, and fluid gets pushed out into the surrounding tissue. That's where the swelling comes from. On its own, mild ankle puffiness rarely means anything serious. Paired with the wrong combination of signs, though, it can be one of the first places heart trouble shows up, often months before a single test gets ordered. That timing matters more than most people realize. Heart-related changes tend to build gradually, one small shift at a time, which is exactly why they're so easy to explain away individually and so much harder to ignore once you see them lined up together. Nobody on this list needs to be a doctor to use it. Each sign gets the same simple treatment: what it actually is, why it happens, what a normal version looks like versus a concerning one, and one specific thing you can do about it today. There's also a right side, left side detail worth knowing up front. When the right side of the heart is under strain, fluid tends to pool in the legs and feet. When the left side struggles, it shows up more in the lungs, which is part of why breathing changes make an appearance later on this list too. 6 signs made this list, counted down from 6 to 1, and the final one is a simple test you can try on yourself in under a minute. Stick around for that one. Let's start with sign number 6. Sign number 6. Your shoes fit fine in the morning, tight by evening. Picture someone like a retired teacher who spends her mornings gardening and her evenings noticing her socks have left deep grooves around her ankles. Mild in the morning, noticeably worse by night. That pattern is one of the most common early clues. When the heart's pumping strength drops even slightly, blood moves more slowly through the leg veins, and gravity pulls fluid downward hour by hour. Swelling in the feet and ankles tends to be less severe first thing in the morning and worsens as the day goes on. Rest and elevation overnight typically reset the swelling, at least early on, which is why so many people dismiss it as nothing. What makes this sign more than cosmetic is which leg swells. If the swelling shows up in only one leg, that points toward a blood clot or a local infection rather than the heart. When ankle swelling is related to heart strain, it generally shows up in both legs at once, roughly evenly. A simple habit helps here. Check both ankles at the same time each evening for a week, and note whether they look the same on both sides. Press gently along the shin bone too, not just the ankle itself, since fluid tends to travel upward as it builds. Write down whether the swelling is fully gone by morning or only partly gone, and whether it's starting to creep further up the leg over successive weeks. A pattern that lingers longer each week, even slightly, is worth mentioning at your next appointment, rather than waiting for it to become dramatic. There's an emotional side to this one worth naming honestly. Plenty of people notice this exact pattern for months, quietly assume it's just age or standing too much at work, and never say a word to their doctor because it doesn't feel urgent enough to bring up on its own. That hesitation is understandable and honestly common, but it's also exactly the gap this list is meant to close, one small observation at a time. One-sided swelling, especially with pain, warmth, or redness, is a different situation entirely and points toward a possible blood clot, which needs same-day medical attention rather than a wait-and-watch approach. This video offers general education, not personal medical care. Any new or worsening swelling deserves a proper evaluation from your own doctor, not a guess from a screen. A practical way to check symmetry without overthinking it: look at where your sock leaves a mark on each leg and compare the depth and width of that mark side to side. Roughly matching marks on both legs fits the pattern described here. A mark that's clearly deeper or wider on one side changes the picture entirely and points back toward that clot or infection possibility rather than the heart. 6 down. Sign number 5 involves a number on your bathroom scale that has nothing to do with what you ate. Sign number 5. The scale jumps overnight, and it isn't food. Now imagine a man who steps on the scale Monday morning, then again on Thursday, and finds he's up 4 pounds without changing a single meal. That kind of jump usually isn't fat, and it isn't muscle. It's fluid. When the heart can't pump efficiently, blood flow to the kidneys drops, and the kidneys respond by holding on to sodium and water instead of releasing it. That retained fluid has to go somewhere, and it often settles in the legs, the ankles, and sometimes the abdomen. Cardiology teams take this seriously enough to hand out a specific number. A weight gain of roughly 2 to 3 pounds in a single day, or about 5 pounds within a week, is generally the point where a doctor or heart failure nurse wants a phone call. And here's the part that surprises most people. Some individuals can quietly retain up to 15 extra pounds of fluid before any swelling becomes obvious enough to notice in the mirror. The scale can catch what your eyes haven't yet. It's worth reframing this before it turns into panic. This isn't about a single bad morning on the scale. Weight naturally shifts a pound or two day to day from normal food and hydration changes. What matters is the trend, not any one reading. The fix is low effort and high value. Weigh yourself at the same time each morning, in similar clothing, after using the bathroom, and jot the number down. A phone note or a simple notepad by the scale works fine. Watch for a pattern rather than a single spike, and pay closer attention if that upward trend coincides with the tighter shoes described in sign number 6. Think of the scale as an early warning gauge rather than a judgment tool. It isn't measuring willpower or how well you ate this week. It's measuring how much fluid your body is holding onto, and catching that trend 2 or 3 days sooner than the swelling becomes obvious can genuinely change how quickly a doctor can help. One caveat worth naming: a single high reading after a salty restaurant meal or a day of less movement than usual isn't automatically a red flag. Sodium intake in particular can move the number on the scale for reasons that have nothing to do with the heart, so context matters before you assume the worst. It's the sustained upward trend over several days, especially alongside other signs on this list, that deserves a call to your doctor. As always, this is general information, not a diagnosis, and any concerning weight change should go through your own physician. 5 down. Sign number 4 shows up not on the scale, but on your pillow, and it might explain why you've been sleeping propped halfway up without really knowing why. Sign number 4. You suddenly need more pillows to breathe comfortably. Think about somebody who used to sleep flat on their back for decades, and over the past year quietly added a second pillow, then a third, without ever connecting the dots. That shift usually isn't about comfort preference. Lying flat moves fluid that has pooled in the legs back toward the chest, which raises pressure in the lungs and makes breathing noticeably harder. Sitting up relieves that pressure almost immediately, and that relief is precisely why people reach for extra pillows without ever being told to. The number of pillows someone needs turns out to be a genuinely useful clue for doctors. 1 pillow is considered normal. 2 pillows might mean nothing, or it might be an early signal. 3 or more, or being unable to lie flat at all, generally points to meaningfully raised pressure inside the heart. There's an even more urgent version of this pattern worth knowing: waking up suddenly gasping for air in the middle of the night, a symptom doctors call paroxysmal nocturnal dyspnea. That version calls for prompt medical attention rather than waiting it out. It's easy to reframe a growing pillow stack as simply getting older or a mattress that's lost its shape. For some people, that's exactly what it is. But if the pillow count has climbed steadily over months, it's worth naming out loud to a doctor instead of quietly adjusting around it. A straightforward step here. Think back over the last 6 to 12 months and count how many pillows you actually use now compared to before. A rising trend, especially paired with ankle swelling, belongs on your next appointment agenda. It also helps to notice whether you've started dozing off in a recliner or on the couch instead of your bed, since that's often the same pattern showing up in a different form. There's a related clue worth a quick mention. Some people notice breathlessness specifically when bending over, such as tying their shoes, a pattern doctors sometimes call bendopnea. It points to the same underlying pressure and is worth mentioning alongside your pillow count if it applies to you. To be fair, breathlessness lying flat has other explanations too, including sleep apnea, excess weight around the abdomen, or a lung condition. This sign alone doesn't point to one cause. If your partner has mentioned loud snoring or pauses in your breathing at night, that's worth mentioning to your doctor alongside the pillow count, since sleep apnea and heart strain can sometimes overlap. As with every sign here, this is educational information, and any breathing changes deserve a real conversation with your physician rather than a guess based on a video. 4 down. Sign number 3 has nothing to do with your heart directly and everything to do with why you keep waking up at 2 a.m. Sign number 3, you're getting up 2 or more times a night to urinate. Consider someone who never used to wake up at night and now finds themselves shuffling to the bathroom 2 or 3 times before sunrise, chalking it up to getting older or drinking water too late. Age plays a role, but there's a heart-specific mechanism worth knowing. During the day, gravity keeps extra fluid sitting in the legs. Lying down at night sends that fluid back into general circulation, and the kidneys process the extra volume as urine, often waking a person hours after they've fallen asleep rather than during the day. The connection between this pattern and heart strain is stronger than most people expect. Nearly 80% of people already living with heart failure experience this nighttime pattern regularly. In one study out of a European hospital, researchers following patients with coronary heart disease found that frequent nighttime urination often showed up months before chest pain or breathlessness ever did, meaning it can act as an early warning rather than a late one. That's worth sitting with for a moment. A bathroom habit, something most people would never mention to a cardiologist, may be one of the earliest fingerprints heart strain leaves behind. Distinguishing new from lifelong is the useful move here. If this is a recent change, especially over the last several months, and especially paired with evening ankle swelling, it's worth flagging specifically as a new nighttime pattern rather than folding it into a general getting older conversation. A quick way to track it: note how many times you wake to use the bathroom for a week, then compare that number to how things looked a year ago. 2 trips a night that used to be 0 is a meaningfully different picture than 2 trips that have always been normal for you. It's worth softening any self-blame here too. This isn't about drinking less water in the evening, though that can help a little. It's about paying attention to a shift in a pattern your body has quietly changed on its own. To be clear, frequent nighttime urination has plenty of non-cardiac causes too, including prostate changes in men, overactive bladder, certain blood pressure medications, and simply drinking fluids close to bedtime. Reviewing your medication list with a pharmacist or doctor is a reasonable first step if you take a water pill or blood pressure medication, since timing can sometimes be adjusted. One sign alone rarely tells the whole story. This is general education, not a diagnosis, and any new nighttime pattern is worth raising with your doctor. 3 down. Sign number 2 is the one almost everyone has, and almost everyone blames on the wrong thing. Sign number 2. Ordinary tasks leave you more tired than they should. Imagine someone who used to carry in the groceries in one trip without a second thought, and now finds themselves winded after unloading the dishwasher or walking to the mailbox and back. That kind of fatigue, tied to tasks that used to be effortless, deserves more attention than most people give it. When the heart's pumping capacity drops, less oxygen-rich blood reaches the muscles doing the work, and the body responds with a heavy, run-down feeling that rest doesn't fully fix. This sign carries extra weight for one group in particular. Unexplained fatigue during light activity is one of the more common heart symptoms, and for women, it's often the very first sign of heart trouble, arriving well before anything resembling classic chest pain. It helps to reframe this rather than push through it. Slowing down here isn't a character flaw, it's about noticing when your baseline has shifted. A useful comparison isn't yesterday, it's a year ago. Ask yourself honestly whether the same walk, the same errand, or the same set of stairs takes noticeably more out of you now than it did 12 months back. Try keeping a rough mental log for 2 weeks. Which everyday tasks leave you unusually winded or drained, and whether that's new. Bring that specific comparison to your doctor rather than a vague, "I've been tired lately." Specifics travel further in a short appointment than general impressions do, and climbing my porch steps now leaves me short of breath, and it didn't 6 months ago, gives a doctor something concrete to work with. This is also the sign people most often talk themselves out of. It's easy to blame a bad night's sleep, the weather, or simply getting older, and sometimes that's exactly right. But when it shows up alongside the swelling, the scale creep, or the extra pillows already covered, fatigue stops being background noise and starts being one more piece of the same picture. Fatigue has a long list of ordinary explanations, including poor sleep, low iron, thyroid changes, and medication side effects. So this sign alone isn't proof of anything. A basic blood work panel can rule several of those causes out fairly quickly, which is often a helpful first step, regardless of what's ultimately behind the tiredness. But paired with ankle swelling, breathlessness, or the nighttime bathroom pattern already covered, fatigue moves from background noise to something worth naming directly and specifically at your next visit. This is educational content, not medical advice, and persistent fatigue always warrants a conversation with your physician. 2 down. Sign number 1 is the one I promised you at the start, and it's something you can actually try tonight. Sign number 1, the 15-second press test and what it actually tells you. Here's the test clinicians reach for constantly, and almost nobody outside a medical office knows exists. Press a finger firmly into the swollen skin over your shin bone or ankle bone and hold it there for about 5 to 15 seconds. Then let go. If a dent or pit stays behind in the skin instead of bouncing back immediately, that's called pitting edema, and it's one of the clearest physical signs that fluid has built up in the tissue rather than the swelling being something else entirely, like extra weight or muscle. Doctors even grade what they find on a scale most people have never heard of outside a hospital room. A shallow dent of about 2 millimeters that fills back in almost instantly is graded as mild. A dent of 3 to 4 millimeters that takes up to 15 seconds to smooth out ranks higher, and a deep pit of 6 to 8 millimeters that lingers for a minute or two, sometimes longer, points toward more significant fluid buildup. You don't need to memorize that chart to get value from this test. The real usefulness is simpler than that. Does a dent form at all? And roughly how long does it take to go away? Even a rough answer to those 2 questions gives you and your doctor something concrete to work from, instead of a vague description like, "My ankles seem puffy sometimes." A quick technical note that makes the test more reliable. Press with a fingertip or thumb over a bony area, like the shin or the inner ankle bone, rather than soft tissue, and hold steady pressure for a full count of 5 to 10 before releasing. A glancing or rushed press can miss real swelling entirely, which is a common reason people try this once, feel nothing, and assume everything is fine. Here's why this sign earned the top spot. It's the moment where 5 separate clues, evening swelling, a climbing scale, extra pillows, nighttime bathroom trips, and unusual fatigue, stop being separate observations and become one physical test you can run in your own living room. An estimated 6.7 million Americans over age 20 are currently living with heart failure. Researchers expect that number to keep climbing over the next several years as the population ages. Within that broader group, heart failure is most common among adults over 60 specifically, which is exactly the audience watching this video right now, and part of why this particular age cutoff matters more than it might first appear. Keep this in perspective. This test isn't meant to scare you, and it isn't a diagnosis. It's meant to turn a vague sense of, "my ankles have been puffy lately," into a specific, useful data point you can describe accurately to a doctor instead of a shrug. If you press and a dent lingers, especially alongside 2 or more of the other signs covered today, don't sit on it. That combination is worth a call to your doctor this week, not something to monitor quietly for another few months. Bring your notes on shoe fit, your scale trend, your pillow count, and your nighttime bathroom pattern to that appointment. Together, they tell a far more complete story than any single symptom on its own. One last caveat, because it matters. Pitting edema has causes beyond the heart: kidney function, liver function, certain medications like some blood pressure drugs, and simple prolonged sitting or standing on a long flight or car ride can all produce the same dent. This test is a prompt for a conversation, not a self-diagnosis tool. It doesn't replace an actual medical evaluation, an echocardiogram, or blood work ordered by a real physician. Please treat everything in this video as general education rather than personal medical advice, and bring any concerning combination of these signs to your own doctor rather than relying on a video, however well researched, to make the call for you. 6 signs, one simple test, and a pattern that's easy to miss when you're looking at each piece on its own. Tighter shoes by evening, a scale that creeps up without an obvious reason, an extra pillow or two, more nighttime bathroom trips than usual, ordinary tasks leaving you unusually tired, and a dent that lingers when you press your own ankle. None of these 6 is a diagnosis by itself, and that's worth repeating clearly before we close out. But if even 2 or 3 of these sound familiar, that's genuinely worth bringing up honestly with your doctor, not a reason to panic, and not something to quietly monitor on your own for another 6 months, hoping it resolves itself. Which of these 6 surprised you the most? Drop it in the comments below. I read every one, and your answers genuinely shape which topics we tackle next on this channel. If this kind of research-backed breakdown is useful to you, consider subscribing so you don't miss the next one, and share it with anyone in your life over 60 who might benefit from knowing these 6 signs. Take care of that heart of yours, and I'll see you in the next video.